going to talk to Dr. David Perlmutter. He's been on my show before several years ago, and then I kind of lost track of him, and he's pretty busy. That's for daggone sure. But I want you to know that, I don't recommend anybody if I wouldn't go to him myself. And so I have not been to Dr. Perlmutter because so far, praise God, I don't need you, and I hope I never do. But my husband had his surgery about a week and a half ago. He had a knuckle replacement. And so Bob, I hope, is watching. Maybe he'll call in. But Bob has done great. He was in so much pain that when he laid in bed and he'd roll over, he'd wince with the pain from the knuckle. And since he's had that surgery, he's had the surgical pain, which is not real bad at all, but the knuckle has not hurt him one bit. Isn't that awesome?
It's perfect.
I'm not telling you anything you already don't know, am I?
Well, it's important to understand that most people can get their pain better orthopedically without surgery. But when surgery is indicated and it's done well, a great outcome is typically expected.
Yes, and we've had a great outcome. My husband has.
Right.
And Dr. Perlmutter's in his surgical gear because he just literally walked out of the OR to come over here for us. So he probably hasn't had supper. So if you hear some growling, it's probably his tummy.
It's probably my stomach.
So how long have you been here in town now?
I think I'm starting my 7th year.
Oh, okay. You've been here a while then.
I spent my youth practicing in Pennsylvania and moved down here to join Carolina Regional. I strived and looked for a private practice. I did not want to work for hospitals.
Oh, okay.
At least my interpretation of what hospitals were as employers up in Pennsylvania. Here it's different. The hospital system in town here is magnificent. I'd have no trouble working for them. It's just that my mindset at the time was never again.
Right. You're based on what you know.
Right. Hospital systems there are largely competing large groups, and money and profits drove everything. In all honesty, here at Nash and at Vidant, at least Vidant in Tarboro, where I have my experience, where I work as well, it's quality driven. So if I was to be an employee of them, and I have colleagues who are orthopedic surgeons who are employees of the hospital, they get wonderful support. The hospitals are magnificent. Quality is the thing that drives everything. Yes. If you make money, fine, but if you don't, was the person perfectly taken care of?
Right.
And when you have that mindset from the hospital administration, it becomes easy to work for them because it's easy to work with them.
That's right.
Right.
Because the
just
patient,
magnificent.
Just like you, your patient is number one.
Absolutely.
When you are in that OR, I know you were all focused on Bob Prezioso, nothing else.
Most important person in my life.
That's exactly right at that time. And he would have had to face me had something gone wrong. But so tell me a little bit about your volunteer. Are you still doing a lot of that volunteering, going to other countries?
This year is on hold for COVID reasons, right? So our goal over the last 20 some years was to start working at a hospital in a developing country. Third world is not a politically correct term anymore.
Excuse me.
No, it's low and middle income country is a politically correct term. And so for the last couple of years, we've been working in Honduras. In fact, interestingly, San Pedro Sula, Honduras, which is where the caravan came from. I was actually operating in San Pedro Sula when the caravan started.
Okay.
And
it's a very poor country, isn't it? Well,
it's a very wealthy country, but it's a very corrupt country, like a lot of countries without disposable income are. So they have enough to get by. People are comfortable, but we, in all honesty, the United States withheld a lot of critical funding that was funding their police departments, and then when that fell flat, the drug cartels take over, and it's run by mafioso type people now. So,
gotcha.
And so the poor people run to the cities, and then when the cities are under a deluge of rain during the rainy season, they have to go someplace because they don't have the dikes and the water management that we have here, and so they have to leave, and they have to leave en masse, otherwise they'll be killed. So when you hear the term caravan, it's really people walking in mass because they'll be killed if they walk in smaller groups.
Oh, okay, so it's a protection thing.
Just like wildebeest go across the
Right.
Serengeti
That's
in groups,
right.
right?
That's right.
Yeah.
There's a lot of protection in groups. So you
There
do
is.
surgeries there,
We do.
all orthopedic, of course.
We focus every place I've gone, and I've gone to a dozen countries. We've always focused on children, but there's always probably 30% of the patients are adults. When it's elective surgery, when it's emergency surgery, like during the Haitian earthquake in 2012, I went 5 times to Haiti. I was there the day after the earthquake hit. You operated on everybody that you could find.
Sure.
And so it was, the majority were adults, actually. But when you go for electively, we really focus on children because you have a greater impact. We have limited resources, they have limited resources. So you make the biggest impact by operating on the kid that needs it the most.
Right, sure.
Which means you really make decisions about children who really need surgery but will never get
Yeah,
it.
it's a triage system.
Right.
Yeah. So do you operate in hospitals? I mean, is it
We
big?
do.
Okay.
We do. In fact, I'm vice president of the American chapter of the International College of Surgeons, and we are, as part of that, member of a group called the G4 Alliance, of which I'm also on their board. And the former group has a seat at the World Health Organization, and one of our charter goals is to teach a person how to fish instead of give them fish,
Right,
of course,
right.
right? So,
Yes.
so we have to identify hospitals that have the capability to learn and to execute once we've left. So last time I was there, I donated $20,000 in surgical supplies and textbooks and computers and disposable supplies like specialty sutures that they can't get there to accomplish some goals, and surgical instruments that can only do what I do, but they just don't have them, and power equipment. Right? We took drills and special tools that borrow skin from one part of your body and move it to another for skin grafting, and those are incredibly expensive instruments. But to provide them those instruments enables them to continue the work that you teach them how to do.
Right, right.
So the goal is to put ourselves out of business at every one hospital, and so we found a teaching hospital in San Pedro Sula, and we've been working with them for 2 years now, and I could see spending the next 5 years there easily.
Really?
Yeah, wonderful doctors, intelligent medical staff,
Sure.
as well trained as anybody here. They're resource poor, so they can't do the things, but incredibly well trained, compassionate. All the pieces of the gears come together perfectly for a good educational program. So,
You know, it's all about teamwork, isn't it?
it is, and it's all about orchestrating that teamwork.
Yes.
Right.
Yes, and getting pride and personality out of it and just focus on what needs to be done.
Correct.
And you do that. You're a very nice man.
Oh, well, thank you. But it's not just me, it's a large team.
Sure it is.
My office works very hard for it. They enable it. My partners work hard for it by enabling me to spend time away. It's not just a team that goes there, there's a huge
Sure.
team behind.
Sure, that's
So-
right. That's exactly right.
Right.
That is awesome. So maybe, hopefully, probably not this year, you won't be going then,
We're planning on November.
are you?
Yeah, so if American Airlines is flying, I'm going.
Okay.
Yeah,
You'll just take your mask and go.
that's right.
Have mask will travel.
Yeah.